My name's Jessica Anderies. I'm with Spokane Class 21. Right now, I am at Chaz Denny Murphy Clinic. Hi, my name is Jessica. I'm a student with MEDEX, doing my 4-month-long family practice preceptorship.
Hi, Jeff.
My name is Eric Anderies.
Eric, nice to meet you.
Nice to
I'm
meet you.
a student with the University of Washington. How are you doing today?
Good.
Good.
I'm part of MEDEX Spokane Class 21. And I'm currently here at Chaz Market Clinic in Spokane, Washington.
So, what are you here for today?
I have a bad toothache.
I started to pursue medicine as a career in high school. How bad's the pain rating on a scale of 0 to 10?
11.
11, so it's really bad. I always enjoyed health classes. They were pretty much the one class that I just felt passionate about. I was very interested in. The one thing I actually looked forward to learning. So probably all started there.
So what brings you in today?
I have a aortic root aneurysm.
Okay.
As far as where my path began, I didn't really know where in medicine I wanted to be, but I know I wanted to be within that field. So originally I was a physical therapy tech. So I did that for quite a few years. However, it felt very limited.
That sounds about right.
Sounds about right.
I knew that I really liked the human body, the mechanics. I liked the physiology of it. But then when I really started down that road, I realized it was very limited in my scope and what I could do, and I knew there was more.
And where exactly is it hurting?
At
Up
the
there?
top, you see the top one?
Yeah. So the steps I took on this career path, I first went to Washington State University to the nursing program there. I started working as a nurse, and it was a lot of fun. It was a huge learning experience. I was able to do a lot to help my patients as a nurse, but I always wanted to do more. Instead of being a person that was doing the treatment plan, I wanted to be a part of developing the treatment plan and being able to make the changes for my patients.
Just nice deep breath in and hold.
Through my wife, who was a nurse at the time, she suggested I look into becoming a physician assistant. So I did some shadowing, I went and became an EMT, and then eventually applied for a job at an emergency room as an ER tech. And that was a fantastic experience.
Excellent.
I worked on a daily basis with PAs, got to work side by side with them, see their knowledge base, see their skill set. It was really wonderful.
One more time.
I think that was really what kind of helped grow my my desire to work in medicine, especially become a PA.
And then eventually I actually met a MEDEX graduate that went to the Spokane MEDEX program, and she kind of became my mentor. And I just admired her so much, and I pretty much wanted to take the same steps she did, and that's really what I ended up doing. Hey, Bill.
Hey.
Hey, all right. So I have a 28-year-old female patient, and she's presenting today with some dental pain. She's had multiple teeth pulled already in the past. Her gums are tender on that side.
Looks more from gingivitis.
Yeah, exactly.
Okay.
It's a way to audit.
All right, Daniel, the patient for you. Jeff is a 57-year-old male who presents today for establishing care with a primary care provider. He just recently found out about a month ago that he has a 5-centimeter dilated aorta. About to see a cardiologist by the name of Dr. Humard today at 2:30 to establish if they're going to do an elective surgery. So really this is incidental finding, pretty new to him, but we're just kind of getting our ducks in a row for him and figure out how this care.
Do you want to go see her now?
Yeah, that'd be great.
Okay, so let's go take a look at him.
I remember telling Eric about PAs.
Hi, I'm Daniel.
Nice to meet you,
You're
Daniel.
Jeff.
Hello, I'm Bill. Nice to meet you. What brings you in today?
And I just kept talking about them, like, oh, they're awesome, you need to check it out, you need to read up on them, they're fantastic. And so I actually got him information on MEDEX.
While we were going over our prerequisites, Jessica noticed that she had most of the same classes as myself.
I was thinking, oh, wow, I have the same classes.
Which makes sense. We went to our undergrad together, and a lot of her nursing prerequisites were the same as mine.
And then it just dawned on me, like, why don't I apply to this program too? This is ridiculous. So we both ended up applying.
We knew the statistics based off, how the acceptance rate for just one person, then the probability of both people getting to it was extremely low.
And somehow we both ended up getting in, which was just wonderful. Yeah.
The day that we found out we both got in together was definitely one of the top 3 moments of my life.
Going through the PA program with my husband has been really nice.
Being in the program together has been just positive all across the board.
It was such a large change in our life that I didn't know how it would go necessarily. But it turned out fantastic.
We study together, we can go home, we can quiz each other, we support each other.
We just really helped each other the whole time.
It's really nice having that camaraderie and having that relationship pretty much built in.
It was really nice, and I wouldn't trade it for the world.
We were classmates before we started at MEDEX, we're classmates now, we'll probably be classmates later on down the road too.